It's very important that patients understand how treatment is going to work so that you can ensure that they're following all instructions and going through the process as it's intended. The first things a patient needs to do when beginning treatment is to review the contents of their aligner kit, adjust their scan box, set up their Candid app, and take their first scan. Let's start with what's included. Within the aligner kit, there's a few guides and resources, and all of the aligners are going to come packaged individually and separated into this multicolored tab system. The aligner kit also includes a case to store the aligners in while the patient is eating or brushing their teeth. And the kit also includes this triple action whitening foam that acts as a whitener, a breath freshener, and also a solution for cleaning the aligners. Underneath the case and whitening foam storage, the first thing they'll see is a pull tool. So aligners may be tight-fitting at first insertion, and sometimes they're difficult to remove for some people. The hook at the edge of this allows them to grab a hold of the edge of the aligner and pull it off the teeth. The second thing they'll find in their aligner kit is a pack of chewies. These are food-grade silicone, about 1.5 inches long, and these are meant for patients to chew on. And what this does is it helps to seat the aligners, meaning it helps the aligners to fit like a glove. Each aligner set is individually packaged and labeled, so the patient will start at step 1 and wear each set of aligners 22 hours a day. When a patient first begins treatment, they should set up their scan box to adjust it to their specific phone. Watch the following steps for how the scan box should be set up.
Let's see how to set up your phone with your scan box. Hold the phone support with the JAWS engraved pad facing you. Open the jaw by pressing the side opening button. Remove any accessories such as covers from your iPhone. Holding your phone horizontally, place the back of your phone against the support so the back-facing flash and lens are aligned with the window. Press firmly on the jaw to clamp your phone in place, making sure it's firmly secured. Adjust the window's position by holding down the tuning button and moving the support vertically until you can see the lens and flash through the window. Connect the cheek retractor tube to the phone support. Insert the smaller end of the tube with the clipping system into the window. You'll hear a click when the cheek retractor tube is properly attached. That's it!
Patients should check their email for Candid app activation instructions. Patients should follow the instructions in the email to easily set up and log into their Candid app. If the patient can't find their setup email, the provider can send a new email by clicking New Action and then Send App Activation Code.
While their aligners are in production, your patient will receive an email prompting them to download the Candid app to their phone. The app is very intuitive and easy to use. There are 4 sections on the app shown at the bottom of the screen: Home, Reports, Profile, and Help. On the home page, the patient can see an overview of their metrics, including what step they are on, total scans taken, and total scans taken on time. This is an excellent compliance tool that provides behavioral reinforcement when the patient is compliant with their wear schedule and scans their teeth on time. There is also an option to upload a profile picture. In the profile section, there is an option to edit scan notification settings before a patient takes their first scan. Before the patient takes their first scan, they should make sure all the settings are tailored to their needs. In the Profile section, there is an option to edit scan notification settings. The patient can also select whether they plan to use a mirror or have someone help them. Most patients use a mirror to help them see the Candid app's on-screen instructions. Choosing the mirror option will reverse the written instructions on the app so that it easily can be read in the mirror when scanning. Always make sure to tap Save whenever each setting is changed. In the notification settings, there is an option to change the time that you will receive push notifications, reminding you when to take your next scan. Make sure push notifications are allowed in the phone settings by tapping Open Phone Settings. If you scroll down a bit in the profile section of the app, there is also the option to view previous scans, take a demo practice scan, and a library of easy-to-follow tutorials that help guide patients through each step of the process. We highly recommend completing a demo scan before the first scan. In the report section of the app, scan reports will populate, based on what the artificial intelligence in the app identifies. Reports will include feedback on oral hygiene, aligner wear tips and tricks, and will prompt the patient to move forward or stay in the current step. In the Help section of the app, patients can access FAQs, and chat with our patient support team for technical support if they have any trouble with the app. And that's the Candid app.
The Start Scan button and follow the instructions. Remove your aligners. Unmute your phone and follow the on-screen instructions. Place your phone into the phone support. Insert your cheek retractor tube into the phone support. You will hear a click when your phone support is properly attached to your retractor. Hold your scan box with one hand on the phone and the other hand holding the tube. Insert one side first, then the other. Your teeth and gums should be fully visible without causing discomfort. Make sure your teeth are in the center of the camera screen. If not, you may need to adjust the position of your phone by sliding it for vertical adjustment. During the scan, audio instructions will guide you through the steps. For this step, bite down on your back teeth and keep your teeth together. Let's go! Double tap on the screen to start the scan. Shift the scan box to one side. Start moving your head as soon as you hear the camera make a sound. Now shift the scan box to the other side. Make sure you move the scan box at the same rate as the progress bar. Scan all the way to the side to make sure your back teeth are well seen. You can also turn your head slightly in the opposite direction if that is easier. Back to the center. If you need to restart the current step, simply press the Restart button. For this next step, you'll have to keep your teeth slightly apart and scan side to side. Double tap to continue. Open your mouth just enough for your tongue to fit in between your teeth. For this next step, you'll have to open wide and scan up and down. Double tap to continue. Tilt the scan box up. Tilt all the way up until you can see the whole biting surface of your teeth. You can also tilt your head slightly in the opposite direction if that is easier. Now tilt the scan box down. Back to the front. Insert your aligners. For this next step, you'll have to keep your teeth slightly apart and scan side to side. Double tap to continue. Take the cheek retractor tube out of your mouth and remove it from the phone support by holding the phone support in place and pulling the cheek retractor tube forward. Take the time to review your pictures. If your pictures do not follow the on-screen instructions, you can simply retake them. Once all your pictures have been validated, you can send your scan. That's it!